We reopened 100% of our schools. That's about 400 different campuses on October 5th for every single student based on parental choice. Obviously, prior to doing that, we went through an extensive conversation with a number of public health experts and medical advisors that we brought to advise our school system to determine what the gating criteria for reopening would be and what the protocols and mitigating strategies would be in place. Obviously, we have created a number of tools, transparency tools, to ensure rapid contact tracing, investigation, communication with parents in case of direct contact with anyone who may be infected. We redoubled our efforts in terms of electrostatic disinfection of buildings on a daily basis, in addition to really modifying the architecture, the internal architecture of movement of students within schools, turning what used to be two directional hallways into one direction, stairways the same way, ensuring that everybody's wearing a mask all the time, ensuring mandatory washing cycles of hands for students, particularly younger students, ensuring social distancing, not only in the classroom, in common spaces, but also cafeterias. And we went as far as even creating a mobile application for our employees who have to log on to the application on a daily basis and go through a series of questions determining their well-being and their status as appropriate to return to work every single day. And we went one step further with partnerships with the University of Miami Pediatric Unit for the mobile testing of students. We've been testing our employees since about March last year, and now we're accelerating the vaccination of our school site personnel who happen to be 65 years of age and older, and are advocating, quite frankly, for the vaccination of all school site personnel who have direct contact with students and the public on a priority basis in the state of Florida.
You mentioned you were testing teachers. Are you also testing students?
We are. So we began the testing of teachers back in March of 2020 through our self-insured health insurance program. We now have 3 sites within our schools where employees can go and get tested as well, or they can go to their primary care physician and obtain a test or any approved clinic. But we're also testing students for free via a partnership with the University of Miami Division of Pediatrics. These are mobile units that go to different schools. They are announced to the community in advance, and they provide free testing to our students.
How the heck did you guys do this and get students back on campus?
We began planning for the reopening of schools when we first shut down schools in March of 2020. Much like the country, we pivoted very quickly to online learning, but we knew that that was not an ideal scenario for all students. We were cognizant upfront of the looming academic regression, the learning loss that some students would go through, particularly those students who were in crisis before the coronavirus crisis, English language learners, poor students, students with disabilities. So we planned during the spring and summer months aggressively for the reopening of schools. And even though we started our school year 100% online back in September, by October 5th, we were ready to open our schools. We had determined what the gating criteria as advised by medical experts, including the current Surgeon General of the United States of America, Dr. Vivek Murthy, who's a friend, and he was invited to be part of this panel of advisors. We had a plan, an operational plan. We had the strategies in place. We had the community well informed about what the expectations were, but we also had science on our side. Look, Dr. Fauci and many other experts, including epidemiologists as well as pediatricians, have contended for a long time. And this has been the subject of recent publications in the American Journal of Medicine, but also through the CDC, that schools have never been super spreaders, that schools did not significantly contribute in any way, shape, or form to the community spread of coronavirus. It's the other way around. It is the community, in fact, that creates conditions by failing to observe CDC recommendations. It creates conditions where positivity rates increase and make it more difficult for schools to continue to function. So this has never been a school problem, and schools have never been a problem here in Miami-Dade because the environment is extremely well controlled. Therefore, the conditions are such that the risk of direct contamination or secondary contamination in the school is very rare, if at all, in Miami-Dade.